I read a study recently too that genetically correlated the risk of erectile dysfunction with the onset of type 2 diabetes.
Yeah, so type 2 diabetes is a condition that is going to degrade the nerves and the small blood vessels throughout the body. And so the nerves and small blood vessels of the penis are going to be affected by diabetes. And so men with diabetes commonly are afflicted with erectile dysfunction because of how diabetes is degrading the blood vessels and the nerves in the penis. Now, having erectile dysfunction doesn't cause insulin resistance, doesn't cause diabetes, but diabetes causes erectile dysfunction.
Very fascinating as we see an increase in obesity in reproductive age men and leads to our other myth, right? Which is Viagra's for older men, young men don't get ED.
So young men get ED a lot more than they used to. Part of that is our obesity epidemic. Another part of that is a different epidemic, pornography. It turns out that the frequent viewing of pornography physically shrinks important centers in the brain that are required for normal erections or for reaching sexual climax. Men who watch pornography several times a week will suffer these changes in these centers in their brain. And since the advent of streaming pornography, we are now seeing a level of erectile dysfunction and difficulty reaching sexual climax in high school aged boys and young men that was unheard of prior to the advent of streaming porn. Prior to the advent of streaming porn, maybe 2% of 18 to 25-year-olds reported erectile dysfunction or inability to reach sexual climax. Now it's at about 25%. And it's because of this epidemic of pornography. And yes, obese men will suffer a decrease in blood flow, a decrease in testosterone, and can suffer from erectile dysfunction. But pornography is an equally, if not more important, epidemic.